Hello, I'm Marley. I'm a nursing student at Vernon College. Today I'm going to be showing you how to change the dressing for a central line. Today we are working with Mr. Smith. Hello, Mr. Smith. I'm Marley. How are you doing today? I'm going to be changing out your dressing line. Before we get started, can you tell me your name and date of birth? Alright. Do you have any allergies that you are aware of? No? Okay. So before we get started, I just want to double check the central line. I'm gonna kind of put one finger on top just to be sure that it doesn't move up close to it while the dressing is still on, of course. And just kind of look to see where my placement is so that I'll be able to refer back to it by the time whenever we get done. So Mr. Smith, I'm gonna have you put on a mask. And normally I would have him turn his head away from the area. I'm going to go ahead and get my field set up. Put my mask on. And now I'm going to don unsterile gloves and take off my dressing. This is all after hand hygiene. Alright. Okay, Mr. Smith, we're going to start taking off this dressing now. You may feel a little pinch as this is coming off. So you want to be careful whenever you're taking this off, and you want to work from the outside in, and you just gently want to pull, but not pull too tight or too hard, but just kind of start on the outside and work in towards the middle so that you can loosen it up all around and not pull out the central line as you are working. Mr. Smith, this dressing is not wanting to come off that well. Okay, so now that I have my dressing off, I'm going to dispose it inside of my unsterile gloves. So I'm going to now reach into my kit and grab my gloves. Just kind of move my kit towards the end. Now I'm going to get my sheet for my sterile setup. Being careful not to touch it on the inside, only the outside. So you can see how it's shiny. You want that shiny side down. Alright. So now you're going to want to go ahead and apply your gloves. Just be careful not to touch any of your fields with the outside of your glove wrapper. position my gloves, get them on good. Okay. So now, move my dressing closer. I have my Tegaderm. I have a iodine swab pack, alcohol swab pack, a 4x4, and then a small 4x4 to go around the central line whenever I get done. I have a measuring tape to check placement with, pickups just in case they are needed, tape, and then another iodine. Okay, so Mr. Smith, we're going to go ahead and get started. I'm going to take the alcohol sticks, go ahead and open them up. So normally we would be using chlorhexidine, but with this kit for today, we're just going to be using alcohol swabs. So you're just going to want to prep around the central line, starting on the inside, and just being sure not to go over anything that you'd already prepped. And take the second one and go a little bit farther. And with this last one, I want to go ahead and clean my central line. So I just want to be sure to get it good and clean, and just be sure not to put pressure and pull it out. So now that we've cleaned it off with the chlorhexidine, we're going to allow it to dry for just a minute. And as we're allowing this to dry, we're going to go ahead and get out our benzoin tincture and just lightly go around it, preparing the skin. I just don't want to actually get it on the mannequin. So now that we've prepared the skin, we're going to take our small 4x4, lift up our central line, and slide that over. So you might go ahead and just look at your placement again just to be sure that you have not pulled anything out. Once that you confirm the placement and you know that it does not need to be repositioned or anything, you can take your Tegaderm, go ahead and peel it back, and place it straight down. Just want to make sure that you get everything good and sealed off. Sometimes these Tegaderms just do not want to work with you. Alright, so on the end of the Tegaderm you can see this little label. We're going to go ahead and peel that off and place it onto the Tegaderm. This is just gives you a place to where you can initial, put today's date, and put the size of the central line that's been placed. That way that whenever the next nurse comes in to change the dressing, they'll know exactly who did it, when it was, and what to expect. So now that we have that on, we're going to take our tape. You can tear off the end, tear off that little tag. I'm going to take a piece and place it onto the patient's chest. And then I like to get another piece and just kind of take that and cool it up onto the chest, towards the shoulder, and tape it down. That way I know that there's no pressure on the central line, and to reduce the chance of it being dislodged.